Procedure is carried out using a colonoscope, a thin, flexible tube equipped with a light and a video camera at its tip. This instrument is inserted through the anus into the rectum and carefully maneuvered through the colon up to the cecum. In most cases, the colonoscope can also reach the terminal ileum, which is the final section of the small intestine. The colonoscope's tip houses a video camera that transmits real-time images to a computer screen, allowing the doctor to examine the colon's interior. It also contains a light, channels for air and water irrigation, and an instrument channel. The irrigation system helps flush out debris or stool, improving visibility and aiding in the detection of polyps. Specialized tools, such as small forceps or wire loops, snares, can be passed through the colonoscope to remove polyps and collect tissue samples, biopsies, for cancer screening. A colonoscopy typically lasts between 30 and 60 minutes and is performed in a hospital or clinic by a gastroenterologist. Patients are usually given a sedative to help them relax. During the procedure, they are positioned on their side while the doctor gently guides the colonoscope through the rectum and colon. The device's flexibility allows it to navigate the natural curves of the colon. In some cases, the doctor may press on the abdomen or ask the patient to shift positions to assist with the movement of the scope. Throughout the procedure, high-definition, magnified video footage from the colonoscope is displayed on a monitor, enabling the doctor to carefully assess the colon's lining. Air may be introduced into the colon to expand it for better visibility, which can cause mild cramping or a feeling of pressure, but deep breathing can help alleviate discomfort. As the colonoscope is slowly withdrawn, the doctor thoroughly examines the bowel lining for any abnormalities. If polyps or suspicious areas are detected, they are removed, and tissue samples are collected for analysis. Although most polyps are benign, they have the potential to become cancerous, which is why they need to be excised. The most common method of polyp removal is snare polypectomy, in which a wire loop encircles the polyp and an electric current is applied to cut it away. The polyp is then retrieved for biopsy. Since polyps lack nerve endings, patients do not experience pain during removal. After the procedure, patients are monitored in a recovery area until the effects of the sedative wear off. Some may experience mild gas or cramping, but these symptoms typically subside quickly. Due to the sedation, patients will need a friend or family member to drive them home. It is advisable to rest for the remainder of the day and avoid making major plans for the next 24 hours. Before discharge, the doctor will review the colonoscopy results with the patient. Recognizing the warning signs of colon cancer. Colon cancer is one of the most common cancers worldwide. While it often develops without noticeable symptoms in the early stages, the body may exhibit warning signs. Identifying these signs early is crucial, as colon cancer is highly treatable when detected promptly. In this section, we will discuss 8 common warning signs of colon cancer. While these symptoms do not necessarily indicate cancer, they serve as important signals that should not be ignored. 1. Changes in bowel habits. One of the earliest indications of colon cancer is an unexplained alteration in bowel habits. This may include prolonged diarrhea, persistent constipation, or changes in stool shape, such as unusually narrow stools. These symptoms could suggest a blockage or narrowing of the colon caused by a tumor. Although occasional digestive irregularities can be attributed to diet or stress, persistent changes lasting several weeks should be evaluated by a healthcare provider. 2. Blood in stool. The presence of blood in the stool is a significant warning sign. It may appear as bright red streaks or as dark, tar-like stools, melena, indicating older blood. Colon tumors can cause internal bleeding, leading to visible blood in the stool. While other conditions, such as hemorrhoids or anal fissures, may also cause rectal bleeding, it is essential to have this symptom assessed by a medical professional. 3. Persistent abdominal pain or cramping. Frequent or severe abdominal pain that does not subside with usual treatments may be a sign of colon cancer. Tumors can obstruct the colon, causing bloating, gas, and persistent discomfort. If abdominal pain becomes chronic or worsens over time, medical evaluation is necessary. 4. Unexplained weight loss. A sudden, unintentional loss of weight can be a concerning symptom. Colon cancer cells consume a significant amount of the body's energy, and the disease can interfere with nutrient absorption. This type of weight loss is often accompanied by loss of appetite and fatigue. If weight loss occurs without changes in diet or exercise, further medical assessment is recommended. 5. Chronic fatigue. Feeling constantly exhausted, even after adequate rest, may be linked to colon cancer. This type of fatigue is persistent and does not improve with sleep. A slow loss of blood from the colon can lead to anemia, reducing oxygen levels in the blood and causing weakness, dizziness, and difficulty concentrating. 6. Feeling of incomplete bowel movements, tenesmus. A persistent sensation of needing to have a bowel movement, even after recently using the restroom, may indicate the presence of a tumor in the rectum or lower colon. This occurs when a tumor partially obstructs the passage of stool, creating the false urge to defecate. If this symptom persists, a doctor's consultation is necessary. 7. Chronic gas and bloating. While occasional bloating and gas are common, persistent and severe symptoms may signal a more serious issue. Colon cancer can cause blockages in the digestive tract, leading to trapped gas and a feeling of fullness even after eating small amounts. If these symptoms persist, especially in combination with other warning signs, medical attention should be sought. 8. Rectal bleeding or unusual discharge. Bright red blood or unusual discharge from the rectum, whether or not associated with bowel movements, is another red flag. While rectal bleeding is commonly mistaken for hemorrhoids, persistent symptoms warrant a medical evaluation to rule out more serious conditions. Routine screenings, such as colonoscopies, play a crucial role in early detection. These procedures allow doctors to identify and remove precancerous polyps before they become cancerous. For most individuals, screening is recommended starting at age 45, though those with higher risk factors may need to begin earlier. Colon cancer is a serious but preventable disease. Being aware of warning signs, such as changes in bowel habits, blood in the stool, unexplained weight loss, and persistent fatigue, can help with early detection and timely treatment. If you experience any of these symptoms, do not delay seeking medical advice. Prioritizing regular screenings and adopting a healthy lifestyle can significantly reduce the risk of developing colon cancer.